numbers concerning the coronavirus. There are now more than 4,400 confirmed cases of the virus here in the city, and at least 26 people have died. Statewide, more than 7,000 people have tested positive for the illness, and the U.S. currently has more than 13,000 cases with at least 193 deaths so far.
As all New Yorkers are being told to stay home, there remain many parts of the essential workforce, including our city's transit workers, who are keeping our trains and buses running. As the number of MTA workers who test positive for coronavirus goes up, the city's transit unions are calling for increased protection. Joining me now to talk about this by phone, we have Tony Utano, the president of the Transport Workers Union Local 100. Thank you for joining us, Mr. Utano.
Thank you, Aaron.
Now, tell me what's the status? Because as of a few days ago, my understanding was that you did not have members that had tested positive, and that number just jumped in the last couple of days. Is that right?
Yeah, just up to a few days ago, there was very little, but that's because there's a process going on where it takes a little time to confirm a positive. But anybody that was presumed that went to the hospital, we took the same precautions as though they were positive, even though the test results haven't come back. We did interviews, we surrounded them, we quarantined them, and that person was in the hospital.
We know that a lot of your members are there scrubbing down and disinfecting the subways, but I wanted to ask you about the bus drivers. I know they had a particular concern early on about whether or not they had the right kind of protection to be dealing with the public at close range.
So right now, we're working with the MTA closely to come up with different scenarios on where we could protect our members better. You know, there's a couple of things out there that we're talking about. We haven't really come to a conclusion, but hopefully soon something will happen. Our members want masks and they want gloves, and obviously there's a shortage of masks and gloves because healthcare workers need them. And if we were to give whatever small amount we have out, it wouldn't even last a day or so. So it would be senseless to give them out.
Right. Well, tell me this. I've been wondering about this. I talked with the president of the MTA the other day, the chairman, rather, Pat Foy, who said that you guys are running, the system is running at a regular weekday schedule today, for example. Is that the case?
That is correct. We're running a regular day. Well, we're running what they call a school close schedule, which is pretty much considered a regular schedule with some shortages because the schools are closed.
Do you expect that to change, especially given today's order from the governor to reduce all non-essential personnel basically to zero at most businesses?
I can't really answer that question because that's really a decision that's got to come from the MTA. But at this point in time, our people have been out there working. We're out there making sure people get to the locations that they got to get to. If they do and make a decision to reduce the service, we are continuously working together. They're not going to just do it without notifying the union. This is something that we're not going to fight with one another. We're going to try and work the best with one another as we can to make sure that our members are safe and the public gets to where they got to go back and forth safely. That's our goal.
These new disinfecting protocols, this sort of new way of wiping down the system twice a day and so forth, do your members have what they need in order to do that? I mean, there are a lot of chemicals involved, and this is a new line of work, right?
That's one of the reasons that you can't just give everybody a mask. If the job requires proper protection equipment with a mask, and the chemical says you need a mask, then of course we're going to have a mask. They have the white suits, and they have all of the stuff when they're wiping down. But basically what they're doing is spraying bleach and wiping down the handrails, the turnstiles, and any kind of contact contact by hand would be wiped out.
Right. Now we're talking about your members who are out on the front lines. At your headquarters, you run a pretty large workplace yourself, just the union staff itself. What have you folks been doing? Have you had to send folks home? Do you know about any positive testing within your shop?
As of today, we have none. But what we did was we went out and bought more computers, and we are running remote operations from the home, and we have limited staff coming in, just to man anything, and everybody's on call. Everybody has a phone, so we're running full operation.
Got it.
But not from the union halls.
Right. And so in a not worst case scenario, but when the wave hits, as the governor puts it, when in about 45 odd days we start to see really big numbers of people who have to be hospitalized, who require medical treatment, and so forth. What's the outlook for you and your members? I mean, you're getting everybody around right now, but are you expecting your workforce to be negatively affected when this wave hits?
I can't answer that question, but I can just tell you that my workforce is out there working, and that's one of the reasons why we're working together to try and kind of when the public boards the bus, maybe being in a different place, being 6 feet apart, to taping off the front of the chairs to put them at the back. I mean, we're working on different scenarios, so if somebody gets on the bus and tries to, if they sneeze or something happens and they have the virus, they start infecting all the bus operators, and then they can't come to work, then there's going to be a problem. But as of right now, we're still working on different ideas to get that done.
Okay, and then finally, just to loop around to where we started, what is your understanding of whether or not your members in substantial numbers will in fact be tested?
We're also, I'm in contact, we're also in talks with the MTA about trying to work something out to get our members and maybe first responders tested. So we are in the process of trying to work something out. We know the tests are difficult to come across, but we're in talks with that right now. There's lots of things going on behind the scenes that that we're trying to get done. But can I just say something about transit workers? This is not this is a serious thing. This is something that people fear, and it is a scary thing. But this isn't the first time the transit workers responded to catastrophes. 3,000 transit workers responded to the towers, and they were on a pile. Hurricane Sandy came, and we were out there working 7 days a week. We respond, we deliver. We know we have a job to move the public. We're going to do that job to the best of our ability. We're going to try and put every safety factor we can to make sure that our members are safe, and we can get the public and first responders and healthcare workers to where they got to go.
Okay, we are right there with you. Make sure you stay in touch with us if there's any other ways that we can help get your message out. Thanks so much for joining us.
Thank you. Bye-bye.